Good afternoon. My name is Joseph Juvrud, and I'll be going over EMS workforce sustainability and why it's a problem. This is for English 1120 mock research conference. So, like I said, my name is Joseph Juvrud. I've been working in EMS for almost a decade between being an EMT intermediate and being a paramedic. What is EMS workforce sustainability and why is it a problem? So, EMS workforce sustainability is the current state of our EMS workforce, which is there's kind of been a mass exodus and an idea that there can be no career paramedics uh, throughout the EMS industry. Um, this is a relatively new problem that's been emerging. Today, I'm going to be going over the whys and how to fix it. First of all, why should we care? Why should we care? The EMS system seems to work fine, right? Well, people who've been calling 911, they're still getting help. XYZ. Um, well, we should care because a shorting in staffages equates to a prolonged response time, a inexperienced or lack of emotional intelligence on scenes, and a lack of operational awareness. What do I mean by operational awareness? Well, certain hospitals can only do certain things, right? Um, Whenever someone's having a heart attack, you can't just take them to the nearest ER, which is a common thought. There are specific STEMI capable services. There are specific large vessel occlusion services. There are specific services for specific traumas, and professional paramedics and professional EMTs, they know these things inside and out off the top of their head. They don't have to think about it. Um, we want to retain these people who have a plethora of experience, so that they can become great mentors for new people who are entering, and so that whenever this emergency matters, whenever it's your loved one, your child, in the event of an emergency, you want them, that highly experienced, highly motivated individual, to be there for you. Whenever we're looking at extended response times, even here in Albuquerque, you know, we're looking at a severe staffing shortage, and what that can mean is, if here, whenever we look at the national rates for paramedics, for full-time paramedics, we're looking at a 30% open rate, with a 55% open rate for part-time paramedics. With that being said, these part-time paramedics are supposed to fill the roles of these full-time paramedics. That's why they open these part-time positions. So whenever we're looking at a 55% part-time open and a 30% full-time open, that equates to about a third or half of the ambulances not being staffed as with paramedics. Instead of 20 ambulances out on the street, maybe you have 11, 12. It's pretty significant, and whenever you're looking at response times, the goal is less than 8 minutes to be at your house, and currently it's just not hitting that. When we think about rural areas like Tijeras, the East Mountains nearby Albuquerque, if they need an Albuquerque ambulance to go transport a patient, we're looking at 30, 40, 50 minutes of downtime, which is detrimental in the case of strokes, heart attacks, etc. Like, it's detrimental. In EMS, we get taught the golden hour, which is between the time of an injury, a severe injury. Within 1 hour, they need to be at the hospital and stabilized. And if they're not there, then their risk of mortality increases dramatically. Whenever we're looking at cardiac arrests outside of the hospital, if there's not an ambulance there within 8 minutes, their rate of mortality increases by 10%. And their rate of mortality was already really high whenever you have a cardiac arrest out in the field. Early 911 activation, early chest compressions, and early defibrillation is the key to saving someone's life outside the hospital. And with these prolonged response times, it's not going to happen. The obvious contributor to the high turnover rates here in EMS is mental health. Um, Obviously, there is significant trauma from the job that's unavoidable. You will see people hurt, injured, dead. There is no avoiding that. But what we can do is we can have these resources available to these people who have these extremely high stress calls. They should be looked after by these companies, and unfortunately, they're not. Um, Here in Albuquerque, we have a great system called PSPG, which is available for all first responders. It's fantastic. The problem is that there's no paid leave. There's no, oh, you experienced a traumatic call. Why don't you take the rest of the day off? That's supervisor dependent. It's not a standard, and because of that, you get people who are financially unstable who they don't want to take the rest of the day off. That's just adding stress because they can't not work the rest of the day. Um, in addition to the normal traumas that we get, there is a culture in EMS of normalizing um, unhealthy coping mechanisms. There's a normalizing of, oh, I drink the sad away, or I'm so stressed out I need a cigarette, or it's a common thing. My my preceptor, whenever I first went to paramedic school, said, "Well, now that you're becoming a paramedic, you're going to get addicted to drugs, sex, alcohol, nicotine, or probably more than one." It's normalizing stuff that should not be normal. There is a culture in EMS of stoicism and being tough and being the unbroken spear, but everybody breaks, and it's normal to not be okay. It's okay to not be okay. And right now in EMS, there is a culture of normalizing your trauma and your PTSD. Whenever we look at the mental health statistics from GEMS, this is pretty tragic. We've got 37% of EMS providers meet the clinical criteria for post-traumatic stress disorder compared to the general population. Depression and anxiety rates are 5 to 10 times higher. EMS providers are 1.4 times more likely to die by suicide than the general population. Everyone who works in EMS or first responders in general, they know someone who's taken their own life. And sometimes it's not something that we can prevent, but many times there are situations where long-term treatment and long-term protocols to deal with these high stress calls could maybe have prevented those. At the very least, they could have alleviated some of the burden that those individuals were feeling. Some of the burdens that I've felt, I've not been granted the opportunity to take care of. I had to financially burden myself to take care of those problems. So, in addition to addressing the culture and the agency, I would say, obligation to take care of their own employees, we now look at the financial aspects, which are also sad to look at. The starting pay here in Albuquerque for a paramedic here at Albuquerque Ambulance, which is the one of the better paying jobs to work at, is $48,068.80 annual salary on the high end, which is looking at $23.11 an hour. The average cost of living here in the state of New Mexico is $46,075. That gives you a $2,000 net profit. No, it doesn't, because this salary does not include federal and state tax. So if you're just working at this job, you are working at a deficit. You will not be able to pay to survive, to live here in New Mexico with that job alone. If you want a family, that's just not possible. The common thing in EMS is to pick up more than you're capable of hours in overtime to compensate for this poor number. There's always overtime available. Every EMS agency across the United States, there will always be overtime available, and EMS workers take too much. They work too much. And it's because of this. It's because they have to. So if they're already burning themselves out, might as well burn a little bit brighter to pay your car, not have to pick which bill to pay this month. It's tragic. Even looking at the federal wages, which are higher, we're looking at a mean salary of $53,000 for national estimates of paramedics. This information from the United States Bureau of Labor Statistics, this information is a little bit skewed because it's looking at paramedics as a whole, including flight paramedics, firefighters, etc. Firefighters get certain guaranteed benefits, including raises, etc., which EMS workers, private ambulance company workers do not get. Why is payment so low, right? Well, it comes down to a couple things. EMS is not federally called a essential service, which means that it's limited to the amount of funds that it can get from the federal government and from state and local municipalities. They are completely funded by state, local municipalities, or in the terms of private ambulance, they're funded through private organizations, nonprofits, or hospital systems. Albuquerque Ambulance is funded through Presbyterian, and Albuquerque Ambulance works in the red every year. Presbyterian, the hospital, we're lucky that they just foot the bill constantly. Whenever we look at shouldn't the ambulance, like I've heard that the ambulance bills are so high, XYZ ABC. Well, the average cost of an ambulance in the United States is about $2,700. The average Medicare Medicaid reimbursement is $1,100. So ambulance companies work at a deficit perpetually. They count on the few insurance companies that will be willing to pay for their ambulance services to actually cover their expenses. Ambulance companies as a whole operate on a razor thin margin, or they operate in the red perpetually, and then they just count on the Lundsey Fund or other sources of income in order to actually keep these companies afloat. Because the alternative is that these agencies go out of business, and then there is no EMS contingent in that area. The next local area would have to cover, which means somewhere like rural New Mexico, if there are no ambulances, the next county gets the 911 call, which again can lead to a 40-minute response time at the low end and a 2-hour response time on the high end. In Los Alamos, New Mexico, which is reservation land, the nearest hospital is 2 hours away, and there's one ambulance who runs that entire reservation. So we've looked at the whys, we've looked at the why you should cares. What's the solution? Unfortunately, there's no clear-cut answer. It's going to take federal, local, state, and agency individual reformation from the ground up. The whole thing needs to be restructured with guaranteed and expected career ladders. There need to be standardized career ladders for paramedics to incentivize them to remain in the EMS field, to promote them to become good mentors for the next EMS crews that are coming on. There needs to be an entire restructuring of how we see EMS as a whole. The fire department plays the EMS role very, very well. The problem is that most fire departments are not fully equipped, fully funded, and fully staffed to handle the EMS load that most of these private agencies take on. Here in Albuquerque, there's one ambulance per fire station, which is 22. But whenever you look at the Albuquerque ambulances that are out on the street, that's another 16 or 20. So now, if Albuquerque ambulance were to be absorbed by the fire department would need to staff at least 20 ambulances, all their gear, all their equipment, all their education, everything for 20 ambulances for 24/7. It's just not feasible unless we do an entire restructuring from the ground up. The common saying is that paramedics are your best friends on your worst days, and that's how we should treat them. we need to treat our best friends better. Thank you.